Intermittent fever. What is an intermittent fever? An intermittent fever is a type of fever where body temperature fluctuates between normal and elevated levels within a 24-hour period. That means it goes back to normal temperature 98.6 degrees Fahrenheit in between two fever spikes within a 24-hour period. Let's see the key characteristics of intermittent fever. It has following features. Fluctuating temperature. The temperature rises above normal and then falls back to normal within the same day. Daily cycle. The fever pattern repeats daily, with periods of normal temperature alternating with periods of fever. Infectious disease association. Intermittent fever is commonly observed during the course of infectious diseases. What is the difference between intermittent fever and remittent fever? Intermittent fever and remittent fever are two patterns of fever, both characterized by temperature fluctuations, but with a key difference. In intermittent fever, the temperature returns to normal, at least once within a 24-hour period. Remittent fever is characterized by the fever's temperature swinging up and down by more than 2 degrees centigrade, but never dropping to a normal level. Following are examples of conditions associated with intermittent fever. Infections like malaria, typhoid fever, septicemia, infective endocarditis, tuberculosis, TB, and urinary tract infections. Inflammatory conditions like rheumatoid arthritis, lupus, and inflammatory bowel disease. Other potential causes include autoimmune disorders, certain cancers, and medication or drug-related fevers.